Okay, so we talked about informed consent. We talked about the pre-participation screening for medical clearance. The next thing we're going to talk about is the CHD risk factor, so coronary heart disease. So this is basically the likelihood that they'll have a heart attack with or without exercise. These risk factors are based on years and years of research. So they have data showing correlations between these risk factors and adverse heart-related events. And so you'll see that these, most cases when they talk about risk factors, they'll just give you these general categories. They'll say age is a factor, they'll say family history is a factor, but you'll notice in this table that there are specific criteria. So these numbers are not arbitrary, are based on the data. So there is a specific point in the data where family history becomes a risk factor. There's a specific point in the data where obesity becomes a risk factor. So don't ignore these thresholds. If they're underneath these thresholds, that doesn't mean that they're not completely at risk. It just means their risk isn't enhanced. And so we may perceive that as cautionary, but we're not going to factor that into the risk factor analysis. Okay, so we're looking at these specific thresholds. So like, for example, family history, for men, it's a death of a male family member before age 55. For women, it's an event before 65. And for smoking, it's if they have quit and within 6 months. So they may have quit, but it's only been 6 months, then it's still a risk factor. Sedentary lifestyle, exercising less than 3 days a week. Notice that obesity is based on BMI and waist circumference. So most of the time they may report body fat percentage, but that's not a factor here. That doesn't mean that body fat isn't related to disease. It just means that the evidence that we have is based on BMI and waist circumference. We don't know what the cutoffs are for body fat percentage. We don't have enough evidence there. Hypertension is 130 and 80. Notice this has recently changed in the last 5 or 6 years. So it used to be 140. So if you look at an older text, you'll see those numbers are different. The current ACSM test is based on these numbers, 130 and 80. Dyslipidemia, LDL, which is your low density lipoproteins, it's your bad cholesterol. If it's over 130, that's a problem. Notice for HDL, it's a less than. So we want HDL, that's our high density lipoproteins, that's our good cholesterol. We want it to be higher. We want it to be over 40 at least. And you'll notice down here that if our HDL is over 60, that counts for us. That's a positive. So we want our HDL to be high and our LDL and total cholesterol to be low. And then diabetes, these are different measurements of blood glucose. Most of the time you're going to get a intermittent fasting glucose value, which is this one that says we want it to be less than 100 to not count as a risk factor. So let's look at some examples. So here's our first one. This is David. He's 26. So age, not a factor, because if we go back to our table, for men, they have to be over 45 to be a risk factor. Okay, he sits at his desk most of the day, so probably sedentary unless we get some more information. His father suffered a heart attack last year at the age of 49. Remember, it was 55 was the cutoff for family history for a male relative. So this is under that threshold. So that would not be a risk factor. Drew quit smoking at that time. So that's about a year ago. So remember, our smoking threshold was 6 months. And so, cigarette smoking wouldn't be a risk factor. He's been sporadically exercising. So he is exercising. in this month, he's been exercising 30 minutes 2 to 3 times a week. Our cutoff for sedentary is that they have to be doing 3 months worth and 3 times a week. So it looks like a lot of weeks he's under that, and he hasn't been walking at least 3 months. So we would count him as sedentary. Obesity, 6'1", 181 pounds. It doesn't give us our BMI, so we have to calculate that. You can do the equations in your calculator. Me personally, sometimes it's easier to just go to the website. So what did it tell us? 6'1" and 181 pounds. Compute BMI. Our BMI is 23. And if we were to go back to our table, our cutoff is actually 30. So he's under for obesity, so that's not a risk factor. Blood pressure is 120/80, so he's under for hypertension. Low density lipoproteins is 160, so that's higher than our 130 threshold, so that would be a risk factor. And so we would actually need to count dyslipidemia. And for pre-diabetes, but his HDL is high, that's why I have a positive there. And because it's over 40, it's over 60, so we get a positive risk factor for HDL. And then fasting glucose is 90, so it's under our 100 threshold, so our pre-diabetes is not. So we have sedentary, we should have a star for dyslipidemia, and then HDL is positive, so we end up with only one risk factor. Okay, so that's how that works, is we would count all of these risk factors and subtract the HDL negative risk factor. So we end up with just one total risk factor for David. For Sue, she's 39, so that's under our age threshold. So age is not a risk factor. She is a non-smoker. She's a truck driver. That's a sedentary occupation. She's a non-smoker, so smoking isn't a factor. She likes to ride Harleys. That's also sedentary. So it looks like sedentary is going to be a risk factor. Her 7-year-old mom died of a stroke recently. The cutoff is 65, so it has to be before 65 to count as a factor. So these heart-related events that are over that threshold, the data just suggests that it's more likely related to age than hereditary factors. That's why this wouldn't count as a family history risk factor. So family history is not, age isn't, cigarette smoking is not. Let's look at obesity. So going back to our calculator, so 5'5", 148. So 24.6. So we're under our 30 threshold for BMI. So obesity is not a risk factor. We don't know our waist circumference. Hypertension is 130/80. That's going to be right on the line, so that's going to count as a risk factor. LDL is 130, so that's right on the line again, so that's going to count for dyslipidemia. And we also have low HDL because it's not at least 40. Again, those count in the same category, so it's just one for both of those. Fasting glucose is 80. That's under our 100 threshold. And we don't have the negative risk factor because our HDL is low. So this person is going to have three risk factors for CHD. Okay, so I hope the examples were helpful in helping you think about the CHD risk factors. When I was talking earlier about the PAR-Q and the decision tree, this is what I was saying was the old way that we decided risk factors. So we would look at this person and say, I'm sorry, you have 3 risk factors. You can't exercise until you have medical clearance. And so for this example, they actually have symptoms of disease that are hypertension and dyslipidemia. So yeah, that's probably a good idea. This person, they are going to get, whether you use the decision tree or use this, they would have the same result, medical clearance. But if you had 3 risk factors up here, age, family history, and sedentary, we don't have any evidence that she actually has disease from those 3 categories, yet in the old method, we would have sent them to the doctor. So this would have been, if that were true, like an age, like a guy that's over 55, their parent had a heart attack at 40, and they're not exercising. We send them to the doctor, and it takes them 2 weeks to get in, and then the doctor wants to run more tests, and that takes a while, and the guy loses their motivation, or they can't afford to go to the doctor. They could barely afford the exercise training, so they're not going to exercise. So changing this decision tree is helping to reduce barriers to people starting an exercise program.